tell you guys a little bit about who we are. So we are the NPNL lab, so the Neuroplasticity and Neurorehabilitation lab. And our lab is our interdisciplinary lab focused on stroke recovery. We have about 8 to 15 lab members, which are occupational therapy students, occupational science, neuroscience, engineering, and computer science. The main things that we do here in this lab is big data analysis and brain imaging for stroke biomarkers to inform care. And this is a picture of the lab members. So what is neuroplasticity? The neuroplasticity is the ability for the brain to flexibly change in response to stress or injury. The changes have to meet the demands of the environment and a new task. So stroke is the leading cause of long-term disability, and early recovery is the best predictor for stroke recovery. 2 out of 3 stroke survivors do not regain full functional mobility even with intensive therapy. So what are the 2 things that you could do in regards to this? And you guys could feel free to answer as well. The answers are right here as well. Okay, so the first thing that we could do is personalize our therapeutic interventions to meet the individual's recovery potential. And the second thing we could do is discover new therapeutic interventions for those that don't respond to anything that's present. So our approach here in the lab is to predict stroke recovery using large data. One of them is called Enigma, and the other is neuroinformatics, both using MRI scales. And Enigma is the Center for Worldwide Medicine Imaging and Genometrics. This is the overall goal of Enigma is to unite the brain imaging and genometrics community worldwide to solve biomedical problems that not just one person could answer. So everyone kind of gathers their information together and works together. So the way it works, like I said, people collect the MRI genetic data information, and then they contribute it to Enigma. That all gets analyzed and uploaded, so it's harmonized across all sites. And then this standardizes the analysis of the pipeline and allows for meta-analysis without the need of direct data sharing between different research facilities. Another thing that we do here in the lab is virtual reality, and this was used during COVID. We use virtual reality at the Keck Hospital, and this was to improve the mental health status of patients who were experiencing COVID-19. It provided stress relief, distraction, physical exercise, maybe if they were just on bedbound, and also cognitive exercises, allowing them to put their attention elsewhere. Another thing that we do here in the lab is also REINVENT, and I'll let my colleague Octavio talk a little bit more about this.
Hi. So, as Annette was mentioning, thank you. One of the things that we try to do here is to create novel and personalized interventions. So on the table over here, like later we can play around a little bit if you want. We have a device that we call REINVENT, which basically takes the signals from the brain or the muscle to provide feedback of what these organs, the brain or the muscles, are doing, so that stroke survivors can recover, to help them in their recovery process. Right? So we also have a couple of videos over there for you to see later, but let's continue.
And this is a picture and a video as well on one of the computers of one of the participants using the REINVENT machine that we use. We also have something called Repo Rehab, and that's okay. So Repo Rehab is a research educational intensive designed to build sustainability long-term workforce of rehabilitation researchers trained in basic data analysis and science. This is directly addressed to challenge certain fields within research and to address the lack of training in computer programming and data science. So this is a group of researchers that just gathers together. Another thing that we have here at the lab is the Stroke Advisory Board. In our Stroke Advisory Board, members share about their lived experience with stroke, and the members also share that lived experience with future clinicians and students so that they could give the best possible practice for the stroke survivors in the next few years. This has been going on for approximately 2 years. Another thing that we have is the health tech makerspace, and I am in charge of this area. It's over there on the other side. So right here, this semester we did a workshop series called Designing for Impact, where students were able to learn about 3D design, 3D printing, how to create a file, a little bit about electronics, Arduinos, and a little bit about coding. Some of the new devices that we got in the lab are this resin printer, a 3D scanner, and some 3D printers. The goal of this space is to make future clinicians comfortable in the makerspace so that when they do practice, they could create something for their patients. And then the last thing that I'll mention here is the Keck 3D printing team. Is also another area within the makerspace, but this area specifically addresses Keck's needs, so the Keck Hospital. And they recently created this catalog for the clinicians to use, where the clinicians are able to just go in this catalog and choose what assistive device works best for their patient, and then we'll go ahead and print it out for them and send it to them. So that's a little bit about us. I have put some virtual reality stuff right there that you guys feel free to play with. We also have some REINVENT stuff and the video that I had mentioned earlier. And currently we have 2 prints running, so you guys could feel free to check them out and see how they're printing on the 3D printers. But welcome to the lab, and we also have snacks for you guys.
So how many stations are there?
3, I guess.
About 3. Yeah. 4
So
if we
it's
count the snacks.
Definitely have the snacks.
Yeah.
So 3D printing and assistive devices over there, snacks in the kitchen, REINVENT, which is virtual reality for rehabilitation, and just virtual reality to play around.
Intervention, does it like improve? You said that like only a third of stroke survivors regain full function. Does REINVENT kind of improve those odds, or like what's the nothing really?
So yeah, the short answer is yes, or at least that's our hope. We already did a couple of studies with this device that we, by the way, made ourselves here in the lab. And then from our research, it looks like it is improving. It's helping people improve or recover. To what extent, that's still another unanswered question that we have. So far, with the very small sample that we had here in the lab, we saw that at the very least, they were being more successful in the task that we were training with them, which is we used these EMG sensors over there at this side of the table, connected them to the wrist extensor and flexor muscles, and then overall, as a group, they all improved in wrist range of motion. So yes, it is helping them, but like to what extent, who works best, that's an open question still that we want to answer someday. But yeah. Thank you.
Is it like the first choice for stroke patients, or it's for the whole cases? Like there's no whole, so and they try each different interventions, so they just the last choice is it this?
So actually, we try to answer both questions here in the lab. As Annette mentioned, like part of our effort in the Enigma working group is that we take data from a lot of people around the world, multiple hospitals doing their kind of research related to stroke, and we try to get a better understanding of how the recovery process works. So on one hand, we're trying to answer that question, but on the other hand, specifically for people that are already chronic, meaning months and years after they had a stroke, and that they stop receiving like additional care, they're just basically doing exercise and that sort of thing. That's the specific population that we wanted to develop REINVENT for. So we still don't know if it would be helpful for them in more acute stages. We think it could, but we haven't tested that specifically. So hopefully it will also be helpful for them. Does that answer your question?
Yes.
Okay, perfect. So yeah, it was developed more for chronic patients or chronic survivors and more severely impaired, so without too much function. And depending on that, like how impaired they were, we can use either the signals from the brain for people that don't have any volitional movement, and we can use the signals from the arms or from the muscles for people that do have some limited movement, people that we can read EMG signals from, but that don't necessarily translate into full range of motion. So we can use a combination of sensors depending on the impairments or the needs of people.
What's your exclusion criteria?
For REINVENT, in that specific study, we had mainly one stroke, mainly from only one side of the brain, because you see that you can have a stroke either on both sides or only on one side. So we were trying to have people that presented with hemiparesis, so just weakness or lack of control or better control on one side of the body. In terms of, we also measured cognitive impairment, and we found that that was not too big of a limitation, like with some boundaries, right? Usually, are you familiar with the MOCA test? Okay, excellent. So initially we thought that we would need people with, let's call it neurotypical cognition, so more than 26 points, but we used it with people as low as, I want to say 20 or 18 points, I believe. 20, I'm sure, 18 maybe. And we saw that it was fine with them. That's partially because, like, since we developed the whole thing here in the lab, we took a lot of time and effort into develop something that would be relatively easy to use, like on their own. Initially, for the first few rounds of the study, we were doing everything here in the lab. Like, we were physically connecting all the sensors to them and helping them with the training. But then, after COVID, like, we were like, okay, we can't do that anymore here in the lab. So let's package it into a portable device that people can take home. So we did that, and that's it. So yeah, it can be used from the stroke survivor on his own or on their own. Of course, it is helpful if we give them in-person training on how to set up the sensors, how to use all of the applications in the computer. But after that, 2 or 3 monitor sessions, then they're good to go on their own. Sorry, can you?
How long post-stroke is coming? Is it actually doing before the period, before the window, or is it like after?
So it would be after they already were discharged from the hospital. The people that participated in this study were chronic survivors. So several months after onset. I think at the time, the earliest that we had was about a year after their stroke. But for the majority of them, it was several years after they had their stroke.
Did the patients undergo other interventions while they were on REINVENT?
For the study that we conducted, they didn't, because one of the questions, or the main question that we were trying to answer is if this thing works. So to avoid any confounding factors, meaning something else that could contaminate this, or attempt to answer that question, we asked them to not, well, yeah, in the screening process, we were kind of like selecting people that didn't participate in other specific treatments for the wrist motion, but they were okay if they were doing some regular exercise and that sort of thing. But that's it. Recently, like just this past week, we finished another round of this study with even less limitations on that. We had a more inclusive criteria for recruiting, and then we're just about to see if that worked as well.
What are the performance components that you found improvement in after using the REINVENT?
Knowing that our sample was relatively small, so it was like about 9 people that participated in this study, the most consistent result was wrist range of motion. But we did incorporate other assessments, like, I don't know if is everyone familiar with the Fugl-Meyer assessment, the action research arm test. What else did we measure? The stroke impact scale. Okay, so depending on the person, some people improved in some of these scales, but not everyone. The only thing that we consistently saw was the range of motion. But we have reason to believe that it could be helpful for other things as well. One theory that we have that we still have to test is that the strategies, because the kind of feedback that they receive from REINVENT is learning how to avoid unintended co-activation of muscle pairs, right? So we know that when we want to do a movement in one direction, typically we just activate the muscles that are in charge of that direction, right? And we turn the other off, or the antagonist muscles off. So, and you probably have seen that after stroke, something that happens is either everything is turned on or everything is turned off. It's very difficult to have this individuated control of the muscles. So REINVENT, what it's trying to reteach them how to do is to do that, to regain the individual control. So one theory that we have is that people also could have improved in other scales, something beyond the assessment of motion, maybe because the strategies that they were using to regain this individuated control were extended to other muscle pairs. Something we still don't know, but hopefully we'll be able to answer something in the future. Okay, any other questions? REINVENT related, Enigma related, assistive devices. If not, we can also like let you explore.
Very diverse people can connect with you guys.
We also have some assistive devices in the 3D printing area, and you guys can play with them.
Has everyone used VR, by the way, before?
Patients. So we just put the VR and we just played a video of nature, like going under the sea and in the wood, and it was really cool. And
Awesome.
they really enjoy it.
So was there like an anxiety or that sort of thing? Or?
It's depression, schizophrenia, and people they've been like in the hospital for 20 years. So that was really impressive to try something new, to see outside the hospital.
Okay, awesome, thank you. So,
Well, I'm in the boundary.
Get out of my mouth.
No, you are in my boundary.
Filming.
No,
Can you describe what you see?
I'm playing the saber thing.
Saber? Lightsaber?
Yeah, the lightsaber. It's like half, you know, half. And oh, okay.
You're doing it?
Yeah, you need to draw your boundary first. Oh, I didn't.
I think mine does.
Here needs to calibrate to what your muscles are doing right now. So we planned it only just for you to see what kind of games we were showing. We can connect the sensors if you want. By the way, try it? This is, for example, something that they see. Like you already have that game over there. And basically the person, we can see here the muscles, or the muscle activity. And then the game responds to that muscle activity. When the person is doing wrist extension, then the character jumps. And when they do wrist flexion, the character stops. So the idea is kind of like something like the Mario Brothers game, kind of. Like you just need to run across the entire screen, avoiding obstacles and aliens and so often getting hurt to avoid dying. So that's the main idea behind this game. So for this one, usually you have a ball and then you throw it, and then depending on how hard and how accurately you're throwing the ball, you receive points depending on the circle that it landed, right? So what we are trying to do here with REINVENT is using either the brain or the muscle signals to try to control a virtual arm that is pushing that ball over there, which is actually what we have over there now. So that is it. Depending on how much only the extensor's muscles were being used, they receive a higher score. If it's more like both at the same time, they just receive a lower score.
It's just based on your effort.
Relax. And then push down. Yep. We're finding the muscle
Is the bunch getting set up?
Yeah.
I'm picking up a video.
Danny, I think actually you can come.
You can relax. Okay. While this dries.
Don't abduct your right shoulder. You're gonna back her. It's okay.
You okay?
Okay. Don't abduct her. This area to not flex it. Naga? Naga?
I guess I just mess up people's name. Yes. Around here. Strap. Here. Nice. Now. Can you hold this for me? Thank you. It's just gonna ask you to squish it. In 3, 2, 1, squish. Squish, 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 squish. And relax. I think that's everything. I know, another one. Okay, now it's gonna take like a minute or two to think and to try to calibrate the activity that we're seeing from you guys. I have a feeling that I might have to. Okay. That's fine. Any hand that you would like to see? Alright. Well, that was basically it. Like that's what people needed to do. Like just clean it with alcohol, put the electrodes, place them on the muscle belly, follow the instructions on the video, and then after another good minute, the computer is ready to begin. So when you see a ball here appearing, try to push. That. So we're trying to do wrist extension. So push. That. In general, it's easier. Like if you do like a sustained push, like instead of trying to. Yep. So when you see the ball, just try to come here and then hold it. Ta-da!
So for a client, you won't see their hand move, but
So it depends. Right now, for ease of use, like for the last study or the last two studies that we did, people were just looking at the screen. But we also have a VR version of this where they don't see their actual hand and they just see the virtual hand moving. And it's usually with the same devices. Like we just take one of the white Oculus headsets and we connect it to the computer and then they can see it also on the headset. Not necessarily. Like if that is easier for the person to have a better control and to. Usually one of the issues that other people have is you're fine, it was just the markers. You're fine. It was a box of markers. Sorry, what? Yeah. For some people, like posture is important to have like to allow them to better relax the muscles that they're not using. So in that case, yes, for some people it's easier to have like the arm resting on the table or on the lap. But the computer actually doesn't. As long as the computer can distinguish between the two directions, it's fine.
So you also got for any like compensation or like.
The computer right now can't tell if you are compensating with other muscle groups, like because that would exactly. We would need to connect it to other muscles to see that kind of behavior. It could be done, like continuing developing on these, but right now it's only looking at two muscle groups at the same time.
$0.03 to make these 3. And then the printing time is going to be 1 hour and 22 minutes total. And also, if you like, let's say like your prints need extra support, you can change the settings right here, and then enable support. And then there's also different types of support, like the tree, the normal, and the manual, so that it could support the device when you have floating areas in your print. Because a lot of the prints, like let's say you have a hole on the top, they'll have a floating area, and it's gonna give you an error.
The purpose of this.
That one is just a fidget, so like you can play with it when you're stressed. So this one is a gas cap, and you could use it like this if you have like weakness in your wrist. You could just use this to twist instead of doing this motion. You would just do this, which requires less force. So this one is a nail clipper for somebody who may only have mobility in one arm, where they just put the nail clipper right here, and then they'll just use your finger to click down. And then it'll just keep doing this motion. We also have another one that like orange and blue one. That one's for the foot. So I'll show you like I know you're recording. But like if you do this, that way you don't have to reach all the way or like twist a certain direction. You're just using this.
Yeah, we need that.
This is a new device I'm making currently, and it's not in the market anywhere. This is for after gender affirming care, so they're able to support their shaft. But like I said, I didn't have any measurements for this, so we started creating the measurements in the whiteboard at the other side. I don't know if you saw everything there. That's this, and then from the computer, then you start slicing and seeing what you want to get out. So then you go ahead and print it. And if you don't like certain things, then you have a feasible object where you could work with and say like, okay, I don't like this chunk or this chunk. Now we can go back to the computer and edit that out. But it's really a process of trial and error, going back and forth. Yeah.
Oh, makes sense. Are the materials expensive?
For this one, no, this was PLA, so this is like the cheaper one. But this is also a prototype, so I didn't want to make it expensive or anything. But maybe the final product will look a little different than this.
Different material.
Different material, different look. Here.
I don't know.
And then this goes right here like that.
Yeah.
But this one, it was not sized correctly, so it just didn't fit the print. But this is for somebody who has weakness in their hand and the ability to do this as well.